Okay, thank you. I'd like now ask WJET TV to please ask a question.
Hey, it's Samir from Jet TV. So I was just wondering if we were able to know exactly what part of the county this individual lived in or where they were active.
We're not revealing that. Obviously, we are concerned about the individual's personal protection and privacy, and so we are not able to reveal that. Erie Talk Radio, do you have a question? Hearing no question there, I guess I'm just, I don't know if there's any other media entities on the phone? Otherwise, we can just open up to everyone for more questions.
Sure. Kathy, it's David Bruce again. Want to talk a little bit more about the supplies that the hospitals have. Are you and Melissa and those at the health department, are you guys satisfied with the number of beds available in Erie, specifically the number of ventilators? Do you know how many there are? And are they a sufficient number if we're to see the number of seriously ill people that some projections have us seeing?
Yeah, this is Melissa LYON, and I had indicated earlier in the week that we are in what we consider full incident command structure. And what that really means is we have a number of branches that are collecting intelligence regularly, reporting back to the command center, the incident commander, and keeping that intel close at hand. Each hospital has a reporting system and mechanism on when we request that information, what that begins to look like. I'm not divulging numbers at this point. Again, I say information's coming in every day. I will default to the panelists if there's anyone in the panel from the health systems that would like to add some value to my comment.
I will say one thing to that we have heard the advice and certainly ask everyone in this community to look at canceling any elective surgery, anything that's not necessary at this time, so that any supplies that we do have would be kept and stockpiled for when the need, we believe, will grow in our acute care facilities for those supplies. So that has been a recommendation that we've seen on a national level, and that would include veterinarians and anyone who is involved in any kind of health care that's not necessary at this particular time, that was more elective, that could be postponed until after we've passed this crisis with the pandemic.
Kathy and Melissa, it's David again.
Yes, David.
I just want to follow up and make sure I'm clear on this. You're not divulging the number of critical care beds and ventilators because you don't have a firm number on it, or is it I want to know. I just want to make sure I know the reason behind that.
We do not have a firm number on it. Obviously, we know we have great healthcare facilities in our community, and of course, they're part of even larger systems. And so, when you look at their resources, I think it's even beyond what we have locally. But it's what do they have in their system to be able to move things as they might need to. I'm speaking really just from a general perspective, not with any real data behind that. But with that being said, I don't think it's any secret that nationally there's a real concern on do we have enough beds, enough equipment to take care of what could potentially be a very, very high need. And that goes back to the point that we need everyone in this community to help us, what we call flatten the curve, so that the people coming to the hospital do not inundate the systems to a point where they cannot handle them. So it kind of goes to the whole message of today is the more people social distance, do this for these 14 days, we're going to be able to reassess where we're at as a community and as a state and a nation, and I think that will give us a much better perspective on where we are in terms of being able to treat those that will come forward. But it's really up to the people of this community. Our systems, for the most part, are well stocked and have great facilities and have the life-saving equipment that we normally need. But this is not a normal situation, and this is why each one of us has to play a part in making sure that they are not at a point where they wouldn't have what they need to take care of us.
Kathy, this is Paul Wagner at Erie News Now. I just wondered, has both UPMC Hammett and St. Vincent stopped all elective surgeries? And if not, why not?
I'm going to leave that up to the two representatives to speak to that.
Hi, as far as UPMC, we recommend that elective procedures for those who are at higher risk should be delayed only when it's clinically safe to do so. And we continue to serve our patients whose procedures our clinicians believe are not medically responsible to delay. We are leaving that up to the individual clinicians.
This is Rodney at St. Vincent. We have also stopped all elective surgeries that are not medically necessary at this time to preserve both nursing staff and personal protective equipment, and that started this week.
And I thank those systems for doing that. You know, I think one of the things we're showing here with this press conference, and we had, you know, an earlier one this week for the media, is that our community health care providers and your community public health system, we are working collectively together, and that's obviously what we need to be doing to be able to fight this as a community.